Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. This is now my 9th week providing a COVID-19 update from the hospital perspective. What I'm going to show today, first of all, is good news in that the COVID-19 hospital numbers are not rising, but they're definitely not dropping as fast as they were in the past few weeks. So let's get started. This slide shows the number of patients in the hospital in our region each day. Our region is defined by all the counties on the bottom of the slide. The purple line are all patients, red are patients in the intensive care unit, and blue patients on the ventilator. What you see in the purple line is that it's definitely dropped over the last few weeks, but on the far right-hand side, that drop has definitely leveled off. In the intensive care unit, and we mentioned this last week as well, it's been remarkable how flat that's been. The rate of decline has been very slow. And that's been something distinct and unique about this surge compared to the last winter surge, is we've seen more patients in the ICU, and that really seems to be persisting. This is information from our hospital. We have 79 COVID-19 patients in the hospital today. That's down only 4 from a week ago. The lower left shows the vaccine status, the lower right shows the ages, and you see the average age is between 60 and 61 years old, whether it's intensive care or in the regular hospital. A little more information from our hospital. The left shows data that really relates vaccine status to mortality or deaths. So in this period of time, since August the 7th, we've had 93 patients die who had COVID-19. Of those patients, you see that almost 75% were not vaccinated, 10% had started but not finished the vaccine process, and 15% were fully vaccinated. But I want to point out the average ages in those 3 groups. You see that the fully vaccinated group was a full 14 years older on average than the group that were not vaccinated. And then actually those in process had an even younger age than that. So this really emphasizes how important it is that from a mortality or death perspective to not just have started the vaccine process but be fully vaccinated. On the right-hand side, this is the number of patients we've had in the hospital and how it's changed over these time periods. So as I said, in the last 7 days we've only dropped by 4, 30 days dropped by 89, but notably we still have 24 more patients in the hospital than we did 60 days ago. So that just puts in perspective that while having 89 patients in the hospital is much better than 170 or 180, it's still a significant number of patients and enough that can affect capacity and the flow of patients through the system. So now, just like I did last week, I want to put a little bit of this in perspective. And so these are a couple slides from the Joint Commission. This is the same slide deck I borrowed from last week, and they have been very gracious to indicate that they want people to use these slides to educate the community. And so this just really poses the question, what if vaccinations didn't work in the context of people dying from COVID-19? So at the end of August, when this was created, about 170 million Americans were vaccinated, leaving around 165 million Americans who were unvaccinated. If the vaccinations had no effect, then we would expect the death toll to look nearly identical between those who were vaccinated and unvaccinated. And so what this shows is a single week in August when about 5,500 people in the U.S. died from COVID-19. And it just shows with the colors if that was evenly distributed, what it would look like. This slide, though, is the actual data. This is what actually happened. And you see of those about 5,500 patients, about 5,286 of them were unvaccinated. These are of those who died from COVID-19 that week. And then the statistic up there, depending on the state you were in, the proportion of vaccinated people who die from COVID ranges from 0.1% to 5% of all COVID deaths. And so I think that is, those 2 slides really again drive home the point about how effective the vaccine is in preventing severe disease. So now I'll make a few points to wrap up. First, we showed that thankfully the hospitalization numbers are not rising. But they're certainly not dropping at the same speed they were a few weeks ago. Second, we showed some information that tied how important vaccination is into reducing the most severe effects of COVID-19, which are deaths or mortalities. And so again, it's so important that everyone strongly consider being vaccinated. If you have any questions about the vaccines, I refer you to my video from last week where I tried to clarify some of the more confusing aspects and just make it all easier to understand. And at least as of today, that video is still up to date. And then finally, just make the point that even though the numbers have dropped, COVID-19 is still very much here and it still poses risk to the individual. And so it's not time to let your guard down. So I'll now close the video the way I always do, with the steps to end the pandemic. Please strongly consider being vaccinated. If you have any symptoms at all, please be tested. Remember the importance of social distancing, and please wear a mask. Regardless of your particular situation, a mask will provide some immediate protection. Also, I'd like to make a comment about just how we're going to handle things going forward. We're going to continue to show data on our Facebook page, on our community dashboard, but we're not going to do these videos at the regular weekly cadence that we have over the last 9 weeks. I'll plan to join you again if we have any specific point we want to make, or if we just feel like the data has changed in a way that we need to provide some more context to it. Again, thank you for your attention over these last several weeks.